Hey everybody, I'm on page 101 in your course pack. We're going to be looking at metabolism, but this PowerPoint slideshow is just for vitamins. Alright, so first of all, we're going to be talking today about fat-soluble vitamins A, D, E, and K, water-soluble vitamins, which include B and C. And just to make a note here, we can make vitamin B12. In fact, we can use our own bacteria that live in our intestine to make and absorb B12. We can make vitamin D through sun exposure, and we can also make vitamin K through our bacteria. They're called enteric bacteria that live in our own intestine. Alright, so to start off with, you will want to know which ones of these are fat-soluble, A, D, E, and K, or ADEC. You'll also want to know which ones are water-soluble, B and C, and likewise you'll also want to know which ones we can make. That's B12, D, and K. Now, those fat-soluble vitamins can be stored in our fatty tissue and the liver, and because they can be stored, we can reach levels of hypervitaminosis with those vitamins. Now, to get to levels of hypervitaminosis, you would have to have extreme amounts taken into your system. Avitaminosis, which is a deficiency for these vitamins, is typically rare. They're more common. Avitaminosis is more common when you have a water-soluble vitamin like B or C vitamins. So as we go through this chart, I'm going to help you make note of what needs to be remembered for the upcoming test, and I'll try to put a star by the things that are important for each one of these vitamins. To start with, on page 101, the fat-soluble vitamins, we're going to run through A, D, E, and K first. And vitamin A is important because it is important for vision. Okay, so it's needed for the rods in our eyes. We, of course, get it from carrots, squash, pumpkin, other yellow and orange foods. And a true deficiency is rare because we do store this vitamin. But if someone does develop vitamin A deficiency, it can cause night blindness. Now, for those of us who do have difficulty seeing at night, they say that myopia or nearsightedness may be the underlying reason, not a true case of night blindness. All right, so on your worksheet, you'll want to fill in the food sources. Yellow and orange foods there go in that blank. Foods like carrots, pumpkin, squash are great examples. Vitamin D is our next one. Why we need it is for calcium and phosphorus regulation in the bones, or metabolism there in the bones. So you'll want to take a moment to jot that down. We do get this vitamin D from dairy products and some green vegetables. We also get it from sunlight exposure because we can transform it into calcitriol using our kidney and liver. The important thing to keep in mind here is the first question and the last one, the deficiency. If a person is vitamin D deficient as a child, it may simply be a lack of it in the diet, or it could be a more complex problem like a metabolism issue. So we call it rickets when it occurs in children and osteomalacia in adults. Either way, this problem results in softening of the bones, and the bones are unable to support the body's weight. In children, that may mean the bones are bowed, especially in the legs, due to the body's weight. But in adults, we actually see, in this picture, the bones may fracture under the body's weight. Vitamin E is our next fat-soluble vitamin. Why we need it, I would put a star beside that one to know it is good for immune function. It also serves as an antioxidant. And you'll notice it comes from a variety of food sources, from oils to pumpkin. Deficiencies of this vitamin are also rare because we do get it in quite a variety of food sources. Vitamin K is our last fat-soluble vitamin, very important one for blood clotting, so I'm going to put a star beside that one. It is also found in green leafy vegetables like spinach and kale. And if you do not have enough vitamin K, then you may have impaired blood clotting or easy bruising. Let me mention for just a moment antibiotics and their impact on vitamin K absorption. Because antibiotics kill the bacteria in our large intestine, that happens to be the location where vitamin K is made by those bacteria and absorbed. So for someone who needs vitamin K for clotting to take place, I'm thinking especially elderly patients here, antibiotics can be very detrimental and cause their capillaries to bruise more easily. So just an interesting link there between antibiotics, bruising, and vitamin K production. All right, so just to summarize, we've covered fat-soluble vitamins A, D, E, and K. We are now going to head to the water-soluble vitamins. These are fat insoluble, so they're not typically stored. They're found in the fluid compartments of our bodies, and the only ones we really store in any levels are B12 and C. All right, so the first one here, vitamin B1, is alternately known as thiamine. I would know that this is a water-soluble vitamin. It's important for nervous system functions. It's found in meats like pork, yeasts, and cereal, and the deficiency here, I would know, is a condition called beriberi. Now you're going to find with all of these water-soluble vitamins, people who either have gastric bypass surgery, maybe don't get enough nutrition through alcoholism or just poor nutritional habits, are the ones that are more likely to develop these B and C vitamin deficiency problems. So interesting backstory here. A lot of these B vitamin deficiencies were discovered when, in the 1800s, people decided, let's see if we can find a way to increase the shelf life of the foods that we're using. So, for instance, when they started looking at rice, they realized that if they took off the portion with some oils in it, they could extend the shelf life of that rice product. Well, unfortunately, by taking off the portion with the oils, the husked rice, that meant that they no longer had the vitamins in there. So if you notice products in the grocery store nowadays, oftentimes they will say that they are enriched. That means that they have had that husk removed, but they have been enriched back with vitamins so that we can, maintain vitamins in our bloodstream and not run the risk of beriberi disease. So unfortunately, it took, in some cases, 30 to 50 years before the government said, hey, what you're doing here is increasing shelf life, but it's causing this widespread nutritional deficiency. So, they had to re-add those vitamins back to these food products. So, enriched rice is one way that we can avoid thiamine or B1 deficiencies. You can see the muscle wasting in this person's body having been due to beriberi disease. Let's talk about vitamin B2, alternately known as riboflavin. This particular vitamin is important because it operates with other enzymes and vitamins. So that's going to be one we put a star beside. The deficiency here is cracked lips at the corners of the mouth and dermatitis. And notice the wide variety of foods that you can get this one from. I'll leave you a moment so that you can jot down some of those food group examples. All right, so once again, we realized back in the 1800s and early 1900s that it was important to have the vitamin portion of flour involved in the making of it, but that unfortunately also is the part that makes it go bad more quickly. So nowadays, when we mill flour, we have to re-enrich it or add back those vitamins here like B2. So you'll notice on bags of flour in the grocery store, they're all going to say enriched for that reason. So I don't want you to think that dry winter mouth, where you may have dry, itchy skin or cracked lips, is a condition that you may be experiencing riboflavin deficiency. This particular condition is rare because most people have enough of this vitamin in their diet through what they eat. So if you do have pellagra, this condition here, then that is related to a riboflavin deficiency. Let's talk about vitamin B3, alternately known as niacin. This particular vitamin is needed for chemical reactions in our bodies that involve enzymes and energy. And again, you get it from a good source of foods, everything from meat to eggs, fruits and vegetables, seeds, and of course beer. And this too can cause pellagra, which is basically the 4 Ds: dermatitis, diarrhea, dementia, and leads to death. So this is certainly one you do not want to have missing from your diet. People who don't eat nutritional food, say those who are alcohol dependent or those who are refusing food, may end up with a niacin deficiency. So once again, you'll notice that these products all say enriched. Down here, this yellow cornmeal says enriched on it. And in fine lettering on the white cornmeal at the top, there's enrichments added back. This is near and dear to South Carolina because South Carolinians eat a lot of cornmeal and corn-based foods. So in the 1800s, they started removing part of the corn hull or husk, and unfortunately it took until 1937 for the government to realize that it was really important to start enriching corn products back with vitamins. So that was almost 2 generations worth of people that experienced pellagra because of the lack of that vitamin B3 in their diet. So that's one of the longer cases of taking to get that enrichment back. So again, a lot of these vitamin B deficiencies result in death. You can see central nervous system, gastrointestinal tract and mucosal deterioration, epithelial tissue problems leads to dermatitis, and the end result here is death. And you can see the dermatitis of the hands of both of these people. And another case here. So in addition to not having enough vitamin B3 in the diet, what could be wrong with someone's digestive tract that would impair them from getting enough vitamin B3? What organ might be damaged or missing? Would it be stomach, small intestine, large intestine? It would be small intestine. So why that particular organ? That's where the absorption of nutrients takes place, including most of these vitamins. B9 is folic acid. This is one that's very important to know. It is not only important for making red blood cells and mitosis of new cells, it's also important for growth. And its deficiency can lead to a condition that's completely preventable in pregnant moms. It's called Spina Bifida. So if you go to the grocery store, you'll notice that most whole grain cereals, crackers, things of that sort will advertise proudly on their front that they give a person enough folic acid for their daily requirements. So a lot of these brands here will advertise folic acid because that's what women need before they're pregnant, because once they're pregnant, it may be too late once they realize they're pregnant and need to supplement with folic acid. So spina bifida occurs when there is a lack of folic acid in the mother's diet, and it is, let me show you the picture, a problem with the spinal cord, because the spinal cord should be housed inside the spinal column here and not allowed to create this opening like you see in this picture. Everything from this point down may be impaired, so bladder and rectal functions and the legs may not have normal function. Completely preventable disease if it's caught by giving moms folic acid or folate before she gets pregnant. And there you can see different types of spina bifida. B12 is certainly important. That's one we've talked about before. It is needed for red blood cell formation. That's definitely important to know. Brain and nervous system functioning as well. We've already talked about this intrinsic factor made by the stomach, that it helps absorb us some B12 through the small intestine mucosa. So we can also get this through bacteria in the large intestine too. Okay, so interesting that B12 is poorly absorbed. That's why we need intrinsic factor to assist with the absorption, and that's also the reason that B12 shots are more effective at increasing your B12 levels than are simply taking oral supplements of B12. You can get this from animal products such as meat, eggs, and milk, but not from plant products. The deficiency here is called pernicious anemia, and that can be avoided by taking in enough B12 during our daily eating of some plant matter or some animal matter there. All right, so these are some things to know on that page. And then finally, we've got vitamin C, which is important for collagen synthesis. Okay, I'll put a star beside that one. We know that vitamin C is found in citrus fruits and potatoes, things like lemons, oranges, for instance. And the problem or deficiency that can arise when you have a lack of vitamin C in your diet is called scurvy or scorbutic. Now, we're interesting as human beings. Other animals, other primates, in fact, can make their own vitamin C, but we cannot, so we have to get it from the foods that we eat. Since collagen is important for supporting the dermis of the skin, holding the teeth in place, and creating the walls of our vessels, you can see why the problems here often result in these issues like liver spots on the skin, loss of teeth, and bleeding. So this is oftentimes called the pirate's disease because those who sailed the seas may not have had enough of those citrus fruits or potatoes, so their teeth fell out because the collagen fibers that held them in place weakened. And there's little red dots on her tongue. You may be able to see them. That is typical of Scorbutic tongue or scurvy as well. And now you're going to panic because you're going to look at the hairs on your arms and think, oh my gosh, do I have this? But little tiny corkscrew hairs can form when a person has scurvy, and that is due to the changes in the way the skin grows those hairs and all the lack of supporting collagen that needs to be in that skin. So don't freak out. Look at your arm hairs, right?